my name is Muskan, and I'm currently an undergraduate student at the University of California, Davis. And I'm also here today as a student from the California Institute of Research and Technology. I was mentored by Dr. Burney, and I would like to express my gratitude for being able to both have the opportunity to work on a case study like this, a poster, and also be able to present in this manner. So today's study, we will be looking at the effects of a specific chemical, aluminum sesquichlorohydrate, on primary hyperhidrosis, and we will be analyzing this through a specific case study of a more abnormal case of hyperhidrosis that we'll be talking about here. So for some background on the disorder, hyperhidrosis is an excessive sweating disorder that tends to have a lot of effects on the patient's quality of life. So there are two types of hyperhidrosis. There is primary hyperhidrosis, which though is not it's common to be genetically linked, but not always in the case. It tends to not have any sort of underlying underlying conditions, and also is focalized to specific parts of the body. So this tends to present itself in like the patient's hands, feet, and armpits and other areas. Secondary is more generalized most of the time and caused by an underlying medical condition. Hyperhidrosis has a very large range of its effects, from mild sweating to sweating that is disabling, which is the case that we are talking about today, where this was a more severe case of hyperhidrosis. And primary hyperhidrosis affects an estimated 3% of the population. Not a lot is known on hyperhidrosis actually right now, so current treatments range from topical medications, so like oral pills, or like medications that you can like physically rub on your hands or so, and Botox injections, iontophoresis, systemic medications, and surgery. So getting into the case study, we are looking today at a 20-year-old Asian woman that presented with primary focal hyperhidrosis. This case was unique in a way that their hyperhidrosis was a lot more severe than like most cases that are typically seen. The patient described that it was very especially her hands were very disabling to her, and that in this case, there was a little bit of a genetic link. A distant aunt of hers had hyperhidrosis, but not nearly to the same extent. And additionally, no one in her immediate family had any sort of excessive sweating. So because this was primary, it was localized on her hands, feet, and armpits, but she reported that her hands specifically interfered with many aspects of her life and work. And her sweating was described as more abnormal for most people, even by physicians and others, compared to people that have hyperhidrosis, making this a more unique case. This was hereditary, and she said that this didn't become an issue until puberty, where she reported that it got worse and that she could not write properly. She also said that her sweating caused her hands and feet to swell up sometimes, and was accompanied oftentimes by a tingling or slightly painful feeling in their affected areas as well. So the patient had done multiple treatments, and most of them, to her report, did not work. So these treatments included iontophoresis, which essentially is a process where the patient would put their hands and feet in kind of wells of water with an anode and a cathode and pass a slight current through it. And this is typically done 3 to 4 times a week at 30-minute intervals, and it's supposed to be a very highly effective treatment. They were also prescribed glycopyrrolate pills, and this blocks acetylcholine from acting. Acetylcholine plays an important part in stimulating sweat, and because of that, it's used in a lot of bladder-related diseases as well. Both of these treatments the patient did not see any sort of effect or any sort of reduction, so these were not successful in her case. The patient also used a lotion with the active ingredient aluminum sesquichlorohydrate, and this lotion was effective. The aluminum salt works physically by blocking exocrine sweat glands, and it is already commonly used in antiperspirants and astringents. So when the patient used this lotion, she noticed that though her sweating wasn't completely gone, it actually did have a reduction. So just to summarize, The 20-year-old Asian woman was presented with excessive sweating and didn't have any sort of successful treatments, even though having tried some, such as the pills and iontophoresis. However, it was the lotion with this ingredient that she noticed a significant reduction in her sweat. So just for an overall case discussion, hyperhidrosis is common, but is not a very well understood disorder, and it exists in many degrees from mild sweating to sweating that is very disabling. And for those that suffer from a more severe extent of hyperhidrosis tend to face a lot of physical and emotional impact from this that ensues. Again, this patient suffered from a more severe degree of hyperhidrosis and struggled with finding a more proper treatment. And this is an example of, this illustrates that every case is unique and not all treatments will work the same on all patients. So something that works on one patient will not work on another one necessarily. But having seen that the aluminum sesquichlorohydrate was the only treatment that proved to be somewhat effective, it should be looked into more properly. And also additionally, because hyperhidrosis tends to present itself in a hereditary manner, recognizing that symptoms early on and targeting treatments before symptoms get worse could potentially alleviate symptoms as well. And to conclude, in patients with a more severe degree of hyperhidrosis, the potential that aluminum sesquichlorohydrate could alleviate symptoms when other more commonly prescribed medications did not seem to help. Because of this, looking to this chemical and seeing what other ways it could be used to couple with other potential treatments could possibly alleviate sweating a lot more. And that is something that should be looked into. So yeah, that was the case study. And once again, I just wanted to thank the California Institute of Research and Technology for allowing me the opportunity to do this today. I'm done.